Right, so continuing on with the housekeeping. Um, Lastly, again, just to submit the questions to the chat since it's hard for me to monitor the Q&A and the chat. So I'm going to just look and make sure I don't have to admit anyone else before we get started. I think we're good. Okay, so looking at our agenda, as always, it's really aggressive, but we're going to have Cindy Elfstead, Office on Aging, talking about the American Rescue Plan Act funding overview. I know a lot of the directors have gotten information, but I want to make sure that the health promotion coordinators also just get the most updated information as possible on the American Rescue Plan, because that's going to be really important over the next 3 years with our programming. And then a couple of programs we're going to highlight today. One is increasing access to health promotion programs for deaf and hard of hearing. I'm really trying to add some health equity into all of our health promotion webinars. And this came about, we had an aging unit that had, I believe the potential participant was deaf, and they didn't really have kind of a protocol on how to accommodate that. So we want to make sure that we all have a process and we're promoting these programs as best as possible to everyone to have access. And then I've had a lot of questions about remote delivery, virtual programming. There's a lot of different devices out there. So I'm just going to have Cassie give you an example of what she's been doing with the Great Lakes Intertribal Council. It's always best for me to kind of hear what's working, and she's been doing it about for a year, so she's got some best practices and some challenges that she'll talk through. And then I have some updates from GWAR, WEHA, and we do have extension on. I know a lot of our aging units are doing strong bodies and the aging mastery program as well. So they'll have some quick updates. So again, really aggressive agenda, but I know we can all do it. So at this time, I am going to turn it over to Cindy, and I'm just gonna backspace here, so you don't need to see that. And I'm going to take off my screen so we can actually see Cindy if you're working from one screen. Okay, and if anyone wants to turn on their video, that would be great. It's, as a presenter, it's really helpful to see faces, but I also understand sometimes that's difficult if you're eating lunch or have kids around. So feel free to turn them on. All right, Cindy, I'll turn it over to you now. Thank you.
Sounds good. Thank you, Angie. And thanks, Angie, for inviting me to participate in this. This is a meeting actually in 9 years in this role I've never attended. So I'm happy to have a chance. And as Angie said, it would be great to just have a little glimpse of everybody if people can turn their cameras on even briefly. I do recognize lots of names, and it's nice to see folks. Thank you. Hi. Great to see you. I feel so fortunate this year to have the opportunity to share good news frequently around funding. And today is one of those opportunities. So I think you may have heard of the American Rescue Plan Act. As Angie mentioned, we've been doing presentations about the Act and how that funding is going to roll out to the Aging Network and the Disabilities Network with the directors, but we haven't had many opportunities to talk to people who are actually doing program delivery. So this is a nice, unique chance to kind of get both information to you and questions you might have about that back to us. So I'm just going to give a little bit of an overview of what this is, and then we'll dive a little bit into how it impacts this program. So the American Rescue Plan Act was the second sort of COVID response stimulus package in 2021, and it's the first one that came through the Biden administration. And like all of the other stimulus packages up to that point, it included some funding for Older Americans Act programming. What was different is that for the first time, it also part of what that funding specified is that Title III-D funding was going to be included. So none of the previous COVID response or recovery stimulus funding provided funds to expand or enhance evidence-based health promotion programming. So this is a new thing, and we haven't dealt with it before, ever, sort of supplemental funding statewide. And so there isn't at this point any particular plan in place. So that's one of the reasons I think Angie wanted to start a conversation, was to start thinking about what the best way to make use of this opportunity would be. So nationwide, the ARPA, we call it, American Rescue Plan Act, brings $44 million to enhance Title III-D programming. For Wisconsin, the section of that was allocated is about 800,000. And how that compares to our normal Title III-D funding is that in a typical year, well, in 2021, for instance, our Title III-D allocation to Wisconsin was about just under 500,000, about $450,000. So it's significantly more than a typical annual allocation. It will get divided into two chunks and distributed to counties and tribes in 2021 and in 2022. So in each of those years, you can expect a sort of a bonus to your normal Title III-D funding of about 1/3 of your normal allocation. That's how we're estimating it. So you'll get the normal allocation and then approximately 33% again. We don't have the exact numbers yet because we're still working out some of the fine tuning, but that's about how it's going to happen. So the allocation to the counties and tribes will follow the exact same, it has to by federal law, follow the same procedure that your normal 3D funding follows. So it's allocated to you based on your local population. So the overall funding for ARPA to Wisconsin totaled about $25 million across all the different Title III programs. So overall, that's approximately a full year's Older Americans Act funding. So when you take into consideration new funds that are going to the nutrition programs, the supportive services programs, and the caregiver support programs, this is a really significant increase in the Aging Network's capacity to do service delivery. It isn't enough to really build staff, and that's one of the problems with this whole approach, but it is significantly increasing the amount of funds available for services. And Wendy Hutter is asking about when the money will be dispersed. So where we are right this minute is nailing down the final budgets for the area agencies on aging, for the part of the funding that will go to them to administer the programs at their level. And once that's determined, then we do the allocations. So we think that we'll be distributing it to be effective October 1st. So half of the funds will be distributed to you in contracts effective October 1st, 2021 through September 30th, 2022. And then the second half would be for that following year. And the way that the feds distribute this funding, they are not putting exactly a hard end date on the expenditures yet. They're saying that there will be a 2-year project period and that the project period will be carried over till the end of 2024. So if you're thinking about sort of projects you might initiate and how long you might be able to sustain them, depending on your strategy for how you use these funds, they can be in place through the end, through September 30th, the end of fiscal year 24. So it's a nice long period to think about doing some innovative program enhancements. So the purpose of the funding, the way it's stated in the Federal Register, is to support expanded need for regular Title III-D services under Title III, with some important additions to the usual uses of some of the funding. So specifically, the part that's allocated for Title III-B is also, in addition to usual 3B services, they're pushing for that to be used for activities related to vaccination and also to addressing COVID-related social isolation and loneliness among older individuals. So in that second kind of clause attached to Title III-B, we're seeing some real openings for collaboration with the evidence-based health promotion area. So we're hoping that local agencies will really take up this opportunity to work toward finding some new programming that addresses social isolation and loneliness using a combination of the power in the 3D network and the funding coming into Title 3B that's accessible for that. And there are a number of folks on this call who are very actively engaged in the statewide collaborative that's going to be working on that. All of the funds have to be spent in ways that are allowable under the Older Americans Act, so there's not a huge change in how you'll use these funds from typical Title 3D, excuse me. What that means is that the 3D part of the funding still needs to be used like normal 3D on evidence-based, highest level evidence-based health promotion. And I won't go into the details on that, but we can provide those if you need them. Angie, Jill, others are definitely at the ready to give you guidance around how to make sure that what you're doing fits that description. There's a couple other things points that are kind of made in the ARPA language around the use of these funds. They're strongly encouraging new partnerships be developed for the use of these funds, particularly in an effort to target communities with the greatest need for enhanced or expanded programming or access. So as with a lot of the other new funding coming through the Administration for Community Living, there's a real hope that some of these opportunities will help address some of the health disparities across different parts of our community. So this, again, like with many other program areas, provides us some opportunities to develop new approaches or to do some new marketing or to look into some new interventions that might apply to parts of your community that haven't really been served in this program area previously. I'm looking at my notes because there's a lot of detail around this funding. I think, yeah, Angie and I talked a little bit about just some sort of broad points that we want to communicate about this funding. One of the most significant ones, I think, is just to reiterate the idea that we can get a lot more out of the overall ARPA funding by collaborating across program areas. And this is not unfamiliar to Title 3D consumers because that program has been so tiny that we've sort of had to tap other partners and areas since the beginning of the program. But in the case of the ARPA funding, with money coming in from a number of different sources to all parts of the Older Americans Act, there could be opportunities to expand into more programming in areas like nutrition and caregiver support, where evidence-based health promotion programming exists but isn't always widely implemented. Those program enhancements can tap the 3C1 and C2 funding and the 3E funding for caregiver support. So there may be ways to take advantage of the fact that there's a little bit more funding in the system to expand the approach that you are experts in into some of your other program areas. Excuse me. And one other point Angie and I were talking about making is just encouraging folks to be aware of the opportunities for advocacy for why this kind of expansion is needed permanently. You know, the fact that it took 4 waves of funding for Title 3D to be included in the stimulus funding is of concern. I'm glad that it has been included this time. I think demonstrating, keeping good record of what you do, of the innovative stuff that you're able to do with this new funding, or even just of basic needs in your community that you're able to meet because of the enhanced funding is going to be something we'll want to do to make the case that this needs to continue, that Title 3D needs to be expanded. There's going to be, we anticipate, some pressure in some local areas to transfer parts of this 3D funding to other parts of Title 3 because the COVID response in particular has required such massive increase of the home delivered meal program that we've seen in all the waves of stimulus, a lot of pressure to transfer most of the funding to Title 3C2. So there too, there's an opportunity for you to put together talking points, and we'll certainly be supporting that at the statewide level to make the case that this program area is critical too for people's ability to sustain their independence and to stay healthy and actively engaged in their communities. So just again, some opportunities for advocacy for why evidence-based health promotion programming is so critical to our entire network. So with that, I'll open it up for a couple questions. I don't think we have a lot of time for this area, but I think we do have time for a couple questions. Angie, is that true?
Yep, I don't see any in the chat right now, but you know, I felt it was important to invite Cindy to get kind of an understanding of the ARPA funds as you're heading into your writing your plan goals and submitting those. You know, we want to plan ahead. So we have this additional funding. So how can we create those partnerships to create different infrastructures that is sustainable? And Cindy had mentioned, you know, unfortunately, it's not enough for, you know, perhaps new staffing, but how can we create those sustainable infrastructures within the community? So looking outward and now having a little bit of funding to go to partners with might be a little more attractive as well. So thank you so much, Cindy. This can be a complicated, I think, topic, especially if we're not the fiscal folks in our aging unit or ADRC, but just to have a general understanding, I think is so important for the program managers as we move forward over the course of the next few years. So if you do have any questions, you can reach out to myself or Cindy. If I don't know the answer, I will get a hold of Cindy and make sure you get those questions answered. So thank you so much, Cindy, for being a part of this group. And you can come back anytime. You don't have to
Awesome.
be I'll put you on the invite list so you can come whenever you want.
Thank you. Thanks, Angie, and thanks everybody for your time.
Yes, thank you so much, Cindy. So we're going to move forward. The next on the agenda is increasing access to health promotion programs for the deaf and hard of hearing. And we are lucky to have Carly. I've made you a co-host, Carly. So do you want me to share your screen, Carly, or you can do it as well?
Oh, I can go ahead.
Oh, great.
Yeah.
And then she also has her colleague with her, Chantel Wiedmeyer. Did I say that right, Chantel?
Wiedmeyer, but say it however you do.
Pretty close, pretty close. So I will let them take it away from here.
Cool. Thank you. Okay. Just setting this up. Okay. Can you all see that? PowerPoint. Okay. Awesome. Well, thank you for having us. We are from the Office for the Deaf and Hard of Hearing. We work in the same bureau as Cindy Ofsted that was just presenting. We're right next to her, so not far away. First of all, I just want to say we'll talk about why we're here, who we are, how we fit into this discussion with you guys, and then we will talk about some accommodation language to use, accommodation and service requests, and then we'll provide you with some examples. So Angie actually reached out to me, I would say maybe a month or two ago, explaining that somebody was looking for services or wanted to join a class, some type of prevention class, I think, and they were trying to figure out how do we provide services for an individual that uses American Sign Language, so providing an interpreter. So she thought it'd be a great opportunity for us to just kind of come in here and give you guys a brief overview of how we can help you be able to provide services for individuals that you work with within the community. So like I said, I'm Carly Beery. I work for the Office for the Deaf and Hard of Hearing. My primary role is to interpret. So I interpret for ODHH staff and then various programs under the Department of Health Services. And I also really focus on accommodations. So internally and externally educating, consulting individuals on how to provide best services for individuals. Chantal?
Yeah, hi everybody. I'm Chantal Wiedmeyer.
I can't hear you, Chantel. I don't know if anybody else can hear her, but I can't hear her.
Can you hear me now? That's interesting. I'm not on mute.
Do you have a headset? I'm located in Stoughton, Wisconsin, if anybody knows, well, home based right now, but I work out of the Madison office, and Chantel's over in the eastern part of the state, kind of. So she was saying that here, yes, it's very hot and humid, and in her area, she saw some storm clouds coming through. So that might be impacting some of the connectivity in your area, Chantel.
Can you hear me?
Yes.
That is so weird.
Thank
It was
you.
working before. Okay, well, yes, the storms in my area could be affecting it. I don't know. I have satellite internet. That's all I have available to me here. So any little thing affects my quality. So the storm is probably now affecting my quality. Anyways, Chantel Widmeyer, also working with the Office for the Deaf and Hard of Hearing. I've been here over 10 years now, so super exciting. My primary role actually just kind of changed. I'm the Board for Evaluation of Interpreters Program Coordinator. So that's an interpreter assessment we offer with our office. But I also do interpret still because I have that skill. And so I'm Program Coordinator / interpreter. So nice to be here today. Thanks for having us.
Great. And so really, we are here to provide support for any of your needs that you have related to accommodations, specifically for American Sign Language interpreters and or CART, which is captioning, and Chantel will briefly discuss that in a little bit. But then also if you have any other access issues, related issues, equity type of things with people with disabilities, our whole office, we work for, individuals with physical disabilities, individuals with hearing loss, individuals with other type of abilities. So definitely reach out to us and we'll refer you to the right people as needed. So I want to start with some accommodation language. So an easy way to reach out to more individuals within the community, an easy way to get individuals quick access or availability of access is just to include some sample language within any newsletters that you send out or programming materials that you send out to the community or that you post on whatever mediums that you post them on. So it's really easy to include this language. So I have an example at the top. If you need an accommodation, sign language interpreter, CART provider to participate in this program, let's say it's a stepping on program, please contact, and then the contact person's name, email, and phone number as soon as possible. Or you could say 2 weeks prior to the event happening. So that way it just kind of allows individuals that see that material to say, oh, they're willing to provide an accommodation for me. Now I know I need to request that ahead of time. I don't know, Chantal, do you want to explain CART quickly?
Yeah, so CART is actually Communication Access Real-Time Translation. That's what it stands for. And it's actually basically like captions, but it has a live provider that's listening to whoever's speaking and actually typing on a special machine. And then it sends that. You can either have a big display, so like projected on a big display if you're having a big conference. It can be sent directly to someone's phone, iPad, laptop. It can be put on the bottom of like a PowerPoint. So if you're not seeing a speaker, let's say, if we're in this kind of platform and someone's just showing the PowerPoint, the captions can actually come up along the bottom of the PowerPoint as well. So that's really nice actually, because it's more accurate, obviously, because a person's doing it. So like Zoom has the automatic caption function, which is really nice in certain situations, but a live provider is just going to provide more accuracy in terms of things like that. So CART's a really good tool for people who have hearing loss, and it's also just really nice for big conferences where people may be sitting really far in the back and can't quite hear very well just because of the distance. They can read what you're saying. So really nice service that's also available. And that runs like about $100 an hour is on average what we're seeing, just to give you an estimate of a cost.
Yeah, and like, just wanted to add to Chantel's comment, I think that's important too. So individuals that use sign language, usually that's American Sign Language, that's their primary language. And then like English would be their secondary language. So those are individuals that would rely on an interpreter to receive that information, and then the interpreter would communicate that information out. So the interpreter is the facilitator of that. For that CART service captioning, that's much more like older adults with hearing loss that are missing out, that then can help kind of fill in some of those gaps that they're missing. Maybe they use hearing aids, maybe they don't, to fill in those gaps that they're missing from trying to rely on being close to somebody, trying to like read their lips or hear them in close proximity. So that not a lot of individuals know about CART or are using it, but I think it's becoming much more readily available now and easier to access virtually as well. So much more people are becoming comfortable with using captioning service.
Can I add real quick? I
Yeah.
also thought of, even though this is not related to sign language interpreters, I just want to mention for people with hearing loss, a lot of ADRCs, actually all ADRCs, I think have like a loop system, a portable loop system that connects with people's hearing aids. So then the speaker's voice goes directly to their hearing aid. So another cool tool. So if you have questions about general tools that you can use for people with hearing loss, you can ask us as well, because we may have more information than you already know. So just feel free to ask us.
Perfect. And then just another example listed here is you can rest in a reasonable accommodation, ASL interpreter, caption provider, or other accommodation, and then putting your contact information in there. Oh, and I wanted to add too, so I sent Angie the PowerPoint and then also 2 other documents. So I just gave her these 2 examples and then another document that we'll be talking about. So hopefully Angie, you can send that out to the group so they can have that material as well. Okay, so when it comes to accommodations, so if you don't already have something in place at your ADRC or aging unit, you can contact us. So the nice thing about DHS is there's 2 of us that are interpreters, and if we are available, pending our schedules or booked ahead of time, which is nice, our services are free of charge. So you can contact us and say, hey, are you available to interpret this meeting, this program, this 6-week course? If we are available, we definitely can do that for you. If not, we can also help you coordinate those services. So you don't have to worry about setting up interpreters. You don't have to worry about any of that back end. We are more than happy to do that for you. However, if it's not us, then that would be an outside interpreter from an agency, and there would be a cost involved. Typically, it runs about $75 an hour for 1 interpreter. If the event itself is more than 1 hour, usually that requires 2 interpreters. So just to keep that in mind, but we can, help guide you through that process and, figure out how to do the invoicing and all of that, but we're here to provide that for you. But if you're doing that already on your own, you don't have to come to us for that service. We are just here for that. And then 2, just like we had mentioned, any kind of other, advice needs that you have, or questions that you have, we're more than available just to meet with you, have a phone call, email back and forth, whatever you need. So we wanted to provide you with 2 just examples of things that we have done with our office. So there was a deaf yoga pilot kind of program that we did, and there was a daytime class and a nighttime class, and there was a mix of individuals that were deaf or hard of hearing. So both of the classes, there was an interpreter for both of those. So actually Chantel did the daytime class and I did the nighttime class. It was over on the west side of Madison. And then it was actually, because there were hard of hearing individuals as well, or individuals with hearing loss, there was also CART provided as well. And then Chantel is just going to explain a little bit more about the setup.
Yeah, so for this group, it was just kind of to pilot how effective it would be with providing the accommodations in more of like not an exercise class, but a prevention type class. And so we had played around with setups and things, and we determined the kind of circle / half U or U shape would be best with the instructor in the front. The interpreter was there next to the instructor in the front, and we actually did the moves with the instructor so that it was easier for all participants to see and follow. We had cards projected, like I said, on the wall. They had a special wall that we could project it on that people could look up and read. We also provided some iPads that participants could borrow, and they could read it from there. So like if you're doing, downward dog, you're facing the ground, right? Your head is looking down. So we thought if there was an iPad in front of a person's face on the ground, they could follow along that way. Come to find out, it was a little bit more distracting for most of our participants than it was helpful. So we actually, we provided it, but it ended up not being used as much as we thought it would be. We also, the instructor, Paul Morose, he had provided some visual cues for participants as well. So like kind of marking the left and the right of the mats, because that's always confusing when you're doing yoga, because the instructor, you're actually like mirroring them, right? So it's a little bit weird. And so we just added some like visual things to help participants, and it was just a pilot overall just to see how it went. And actually it went really well. It's unfortunate, we couldn't host it again due to some funding things, but we learned a lot from it. It was pretty successful.
And then the other one we wanted to tell you guys about was a Falls Prevention of Stepping On program that actually happened at Access to Independence, which is located in Madison, Wisconsin. And what had initiated that conversation was that there was actually some deaf individuals in the community that were like, hey, we want to, we noticed that we're older adults and we've been falling and we want to take a class. So they contacted Access to Independence saying, we deaf, there's a group of us and we want to take this class together. Can you make that happen? So Access to Independence said, well, let's investigate. So they contacted our office, and Chantel and I were available to interpret. And so they ended up having their own separate class. So it was just deaf individuals that attended, which was actually really nice for them. It was kind of like their own little community. It was led by hearing instructors, but that's okay because we were there to provide interpreting services for the class. I believe it was a 7 weeks class, and it was 2-hour class time each time. And it was just really easy, and it was really great for this group of individuals to kind of come together and then to talk about, this week, what did you do? And then the next week, what did you learn from that? What did you practice at home? And just having that own little community kind of supporting each other was really beneficial for the individuals that took the class. And then Chantel is going to talk about also how that setup looked like.
Yeah, so for that room, we also had the U-shape, like we said, with the presenters and interpreters. We actually stood up on a platform, from what I remember, so that the participants could see the instructors sitting basically in front of us, and then we were standing behind them signing for a lot of things. So it was easy. You're in the same line of sight for people. And then when they did exercises as a group, if they weren't using the table to balance themselves, they would go in the back room. We would all kind of huddle around in a circle and do it that way. And we also wanted to mention that if you're doing it with an interpreter involved or any accommodation, it is going to take more time. So for this class specifically, there was a lot of explaining and then doing, because the deaf individuals have to look at the interpreter to be able to see what they're being told. And so we're explaining. And so you don't want somebody who's working on falls prevention and when watching where they're going to be looking this way at an interpreter, the table's over here and I'm walking that way. And you can't physically stand in front of everybody, right? So we had to work with the instructors to say, please explain this part and then pause and let them do it. And then if you have a correction, right, let's just stop the movement altogether. We can approach the person one by one and then correct whatever you see needs to be corrected in how they're moving. So just know it's going to take more time, and we are here though to support you in that. So if you don't have to feel like you need to know the answers on how to accommodate certain people's in classes, because like we are here to consult on that as well, like we said. So, and
then before questions, I actually forgot. I wanted to show you guys just this document that we created. Can you see that there? Yeah. So this is just something that Chantel and I put together for your information. And Chantel, did you want to explain this one?
Yeah, sure. So this one we, like she said, put together, and this just outlines the process of what you can expect if you're using Carly and I to interpret something with your group. So it just explains, that you would contact us through email. You could contact just Carly, just me, both of us, whatever works best for you. We work together and meet often to discuss schedules and emails that we get that might apply to both of us. So you would just contact us and let us know, you have this class coming up, let us know the timeline, the dates, who the participant is helpful. If you forget some of this information, we are going to follow up with you in a phone call or an email just to ask it. But the name of the participant is helpful because we know then if we've worked with this person in the past, if we can fit their communication needs, they may have a unique language that maybe we can't meet, or when we're requesting an outside interpreter, if we're not available, that helps us relay. We can tell the agency, the coordinator, the interpreter referral agency, who this person is, and they can best match, again, an interpreter with that individual. So don't be afraid to give that name because we're HIPAA compliant and we're used to receiving that information. We will ask also for an on-site contact person for obvious reasons. I mean, it might not be on-site, it might be the contact person who's doing it through Zoom. Because if we have tech problems, then we can just reach out to directly to get those handled before the class. And then so Carly and I will work together to see who's available to do what. Maybe we'll tag team it. And if we're not available, we'll request to that agency, like I said. And once we receive confirmation of who the interpreter will be, if it's an outside interpreter, we will confirm that with you in an email and just work out any other logistics that way.
Cool. And that also applies to heart services as well. So we don't provide those, but we can set up those accommodations as well. And then again, there's our contact information. I can stop sharing my screen, and if anybody has any questions for either of us, please, let us know.
Great. Yeah, just feel free to write in the chat if you have any questions for Carly or Chantel. Thank you so much for providing your knowledge about this. I think as we try to get health promotion as equitable as possible across the state, that this is one area where I think we're just not sure what to do in some cases. Some counties have policies and procedures set up very clearly and others don't yet. So I think this is very helpful, and the documents that Carly and Chantel talked about will be coming out in the notes. So you'll have access to those. I will also put them out on GWAR's website under health promotion too, so you can access those at any time. And if you can't find them anywhere, just email me and I'll make sure you get those. So thank you again, Chantel and Carly. I think it's really valuable information, especially the examples that you gave on how it has been working with Stepping On and some of those other programs. So appreciate.
Question real quick. I don't know if maybe you and Carly discuss this on the side. I just wanted to ask about how you guys promote your classes or things that come up, because I wonder if we can share that somehow through our email list, because we have an email list with our office that have deaf subscribers or people who have hearing loss. And so maybe that's another way to increase participants from these groups in your classes. I don't know.
That's a great idea, Chantel. Actually, most of our the folks on the call, aging units and ADRCs, have a newsletter where they send that out. So, and that's primarily where we see the most of the participants are through individual county newsletters. But we have seen an expansion with virtual programming to be more of a centralized location where anyone from any county can join. So we're seeing that expand. So I will definitely reach out to you both about how we could accomplish that. So great idea. Love it. Great. Thank you. I'm looking, I don't see, oh, somebody did say, can you provide the CART acronym again, please? Oh, and then Chantel already typed it in, Communication Access Real-Time Translation. So.
Well, thank you again for having us.
Yep. Thank you so much.
Yep. Thank you.
Okay, so next we're going to move on the agenda to Cassie Hurd. And Cassie is with the Great Lakes Intertribal Council, and she's been doing health promotion programming among other job duties as assigned. And, you know, with COVID, she started into the realm of the grandpads. So she's really kind of dove right in with that. I've been getting a lot of questions about how to build out remote or virtual programming to have it in addition to in-person or maybe one-on-one, to have that option of virtual. And there's so many different devices out there, and we wanted to give you an example. We're not endorsing GrandPad, but
Right.
we just wanted to give you an example of how one partner has been utilizing a device to do remote delivery. So I will let Cassie kind of talk through it and then let you all ask questions. So Cassie, I think you can share your screen. Otherwise I can do co-host.
Okay, well, let me just make sure. Well, Annie, everyone, yes, I was asked to do a quick presentation. We started using GrandPads for our health promotion, and so I'll just go over that and some of the positives and the negatives that we found out. I hope everyone can hear me. I can't see anyone, so.
I can hear you.
Yay, okay.
Even if nobody else, it's me and you.
It's just you and me, Angie. Okay, great.
Oh, there's Peggy. Yay, Peggy.
So health promotions using GrandPad. So this is just an overview of the project. So what is a GrandPad? It is a tablet designed specifically for elders. If you go onto their website, they tell you all kinds of information. That one there is actually the tablet that's mine, or the GrandPad that's mine. It has large buttons, simple screens, and it has not too many options per screen, so it makes it really easy. It's the perfect means of connection for elders that are not technologically confident, which is great because it has a call feature, email feature, and Zoom feature, and then also comes equipped with internet. And there's 2 internet providers. So because we were dispersing them throughout Wisconsin, it kind of came in handy that it was Verizon as well as T-Mobile that provided the internet service. So for our means, it worked. So how it started. Oh, go ahead.
Cassie, can I just ask a quick question?
Yeah.
So the participant did not need to have Wi-Fi themselves.
No, I mean, it is
Okay.
Wi-Fi capable, so, but it does come with internet, in which I'll kind of at the end, like when I go over like the pros and cons, that's part of the pros and cons, I guess. But yes, it can connect to Wi-Fi, which in some areas it was better that it was able to, but it comes with internet as if it was like a phone or a tablet that you purchase. So how it started is we had gotten a COVID-19 CARES Act grant funding, and with the Foster Grandparent Senior Companion Program, which partners up elders with a companion or grandparents with a youth, we wanted to do reduce social isolation, but then also allow them to stay connected for that program. But then also in aging, it was our purpose was to reduce social isolation, provide elder entertainment, because as you can see, there's a lot of different games that comes preloaded on there. And then also it became a conduit for our health promotion. So we were able to lease 100 GrandPads for 1 year. And so once that started, it was off to the races. But you can tell here, this is one of the screens on the GrandPad that just describes the games. And then this is how an email would come through. Super simple, like you can compose an email, read a message, or just quit. So there's not very many options. So it does make it handy. So after we had the GrandPad contract and we were getting ready to disseminate them to the different elders throughout the communities, again, 50 of them went to Foster Grandparent Senior Companion Program and their needs. And then we had 50 allocated to aging that we were able to, as referrals came in from the aging units or our own staff here at Great Lakes, we were able to get those out. And so we came up with a schedule. As you can see, we had planned for 4 different health promotion workshops, and then we ended up with 6 because we added the living well once I got trained, and threw that in there, and then we needed an additional healthy living with diabetes. So the beauty of it is that as we gained more and more interest and had this information out there, we were able to just add another class. So in order to attend, so a lot of our peer participants were foster grandparent senior companion participants. So those are all elders. Throughout the program, they needed in-service hours. And so that's how they were able to do that. But also, we had opened it up to others. And so if they didn't already have a grandpad through our program, we were able to offer that up. If they already had a grandpad or a tablet or something with internet connection, we would just help them set up the Zoom and then send them, obviously, every single participant, grandpad or not, the materials that were needed. So I had a few of them that weren't already grandpad users that I ended up loaning out a grandpad for healthy living with diabetes. So so then, as you can see, it's a little tablet. So what we did as facilitators is we tested it to see what our participants would be looking at. So on the grandpad, you can either, it could have shown just the presenter, or if you swiped over, you could see all the members of your team, so, or of the class. So it was important for us to see what they would be looking at, because unlike on a computer screen, it's coming through in a tablet. And so that's important to see. It did give you the opportunity as a participant to mute and unmute and then make it louder or not. So it was very similar to having it on a computer. And it came preloaded with Zoom, and it's a quick little button, which I can show you after the presentation. So it was actually really easy when it came to training for the elders. So once we dropped off the grandpad, one of the things we went over is how to do a Zoom call. And so they were able to, we'd go through that whole application. There were some hiccups along the way. So one of the things is grandpad does come with like a portal where you can see how much your grandpad's being used, see what it's being used for, how much internet they're using, and all of that stuff, which is great. And we at first were starting to coordinate the classes by inviting them to the classes through that portal, but it took like an hour to, or a little bit longer, to get the invite to the grandpad user. So in one instance that didn't work for the class because we had somebody that didn't get their invite, and so then they were late to get their schedule. Eventually we found out that we could just like forward the calendar invite to the participant. It jumped automatically on their calendar, and then the Zoom was right there, the Zoom link, and it would pop up 15 minutes prior to the training, and we were able to get them on. So as far as usability, once we found out what we had to do, it was very easy for the elders to do. And then as far as feedback, they were loving it. They loved Zooming. They thought they were just the cat's meow. So, which I loved, because a lot of the elders didn't have very much experience with technology, didn't have smartphones. And so they were a little bit intimidated, but this made it easy and accessible for them. And so overall, we were able to reach, well, our goal. We're not done with our stepping on, and we're in progress with these two. But our overall reach will be 58 elders. And it would be representative of 7 tribes in Wisconsin. So it's exciting because, one, we're able to fill the classes because you are able to branch out using virtual means. But then also it's easy for them to do, and makes it more accessible for people that maybe wouldn't have access. So moving forward, because our lease is up, which is one of the kind of downfalls of a grandpad, is that it was on a leased program. So then we have to figure out how we're going to move forward. We're not obviously going to have 100 grandpads, but then do we lease 10 grandpads, and during a 6-week course, lease those 10 out, and then after they're done, bring them back. You can wipe them clean, put new information on, and send it back out. Or do we move forward with purchasing a tablet that's not so user-friendly for elders and do a similar process? So those are things that we have to consider. Cost of a grandpad is quite pricey. It's far, because it is a leased program. but it does come with internet, so that also makes it handy. So there's some things that we need to consider, and I need to consider them quickly as our lease is running out. I think that's everything. If anybody has any questions for me.
Yeah, there was one question. What funding did you use initially? I think you said at the very beginning to obtain the grandpads. That was through the grandparent program.
It's COVID-19. It was COVID-19 funding. Yeah. So we had gotten that through our aging program, and then we just we needed to use it, right? So we wanted to, and we wanted to support our aging program, which evidence-based programming is a requirement, and so, yeah.
And then Cassie, were there any back end capabilities that you were able to do? So let's say somebody wanted to do the healthy living with diabetes, and then they wanted to take the stepping on class. Were you able to just put that link, send it right to their grandpad?
Yeah, we actually, a lot of the users had the grandpads anyways because they're part of the foster grandparent program, or we had gotten them referred to by the aging units. So they already had that. And then I would either talk to them when I gave them their grandpad and say, hey, here's your grandpad. This is what it can do. Here's some of the things. But I also am doing these health promotions if you're interested. And if they were, all we had to do is invite them. And then once we had our invite list, we would send out the booklets. And if they didn't have a grandpad, then when I sent out the booklet, I would go, well, what I ended up doing was taking the grandpad and the booklets and materials to them and going over everything with them just for the health promotions. And then they because we're under a year lease and they're elders, we are just allowing them to have them until the end of the year where, so if you were maybe doing a loan program, you would just let them have it for 2 months, 8 weeks, have them return it, reissue it for another elder. But
Wonderful.
I wanted to show you on the calendar. I just sent actually this meeting. I don't know if you guys can see it, but I sent it to the calendar.
Yep,
And
we can see it.
Okay.
Yep.
So if you click on there, you can see I have a new appointment right there. And then if I click on that, then I could join it. It's just so easy for them. So that's what that's what I really like about it. But there's some negatives as far as it is very restricted because you're not trying to have everybody contact elders. They can't add their own contacts. So there's a lot of back end things that you have to do for grandpad users. So there's pros and cons.
And what do you think helped you the most with recruitment? You said you started with 4 and then you ended up adding in a time where I know a lot of aging units and ADRCs are having trouble recruiting. What do you think really put you over the edge or allowed you to recruit as well as you have?
I think a lot of it was, we had all of these users that had grandpads that were chilling at home, right? So they gave them something to do. And once the word got out in the community about the grandpads and about the health promotion, it's kind of spread like wildfire. And so I think the elders really enjoyed it. And then I really do think that that's how it was. It was just based on that. And then also, as I was talking to different elders, I just said, hey, we have this capability. So it definitely helped that we had the option to be able to do it virtually.
Right. And then we just had a comment from Jane Mahoney. Her mom has a grandpad and it's a great device for those who are not good with technology or have memory loss. And there's also a 24/7 customer support, which is great.
True. Yeah.
And then let's see, is a grandpad transferable to anyone else if purchased or registered to someone?
So the way that it's set up is the grandpad, you set it up specifically for that elder. I have one issued to me and you get an email address and you have a phone number on the grandpad. If you wanted it to be transferred to somebody, they'd have to return it to you. You'd have to wipe it clean and then they get a new email address and a new phone number and then it's reissued. And it's all done through grandpad. So it's kind of a process.
Great. And then
Yeah.
there's some comments. Great work, Glitzy. So
Thanks,
kudos to you, Cassie, for really just diving into something that
Yeah.
you didn't know anything about in the
Nope.
beginning. So we
No.
appreciate you doing that, because I think we have a lot of aging units and ADRCs that are looking to build out
Yeah.
remote or virtual programming. Just it's a great way to continue health promotion program in the winter, even when hopefully the pandemic is more under
Yeah.
control. So doing that in addition to in-person or one-on-one, just being very diversified within that.
Right.
And then we do have one more question. Is Zoom the only video conferencing platform that can be used? And I know you're not a GrandPad expert,
Right.
but you're our expert, Cassie. So.
Okay. I know. I mean, I'm pretty sure that the standard GrandPad, which maybe Jane would know, didn't come with Zoom. And that was one of the things that we wanted and that they customized. And actually now Zoom has like a corporate end of it where they will do things like this and again, like a big contract. So I don't know what else could be added. But
It
I do
sounds
know
like
that we
it
have
is
Zoom.
customizable.
Yeah,
So
yeah, they will work with you.
I
And it-
can say that my mom's came with a Zoom
Okay, very
bubble,
good.
but you can put any website on there that you want. So you could use any platform, I'm sure. It's just easier when they do it. And they might be able to do it on the back end for you too.
Right.
great, thank you.
Well, thanks, Jane.
Thank you. It's helpful. So, and Cassie they have 100, and I've been on a lot of national platforms for different educational sessions and conferences. I've heard as few as, they'll just get 5 different devices and loan those out. So they just
Mhm.
always have that option for folks. So a lot
Right.
of different ways to do things. But I just wanted to give you an example of how, how Glitzy is tackling this. And again, lots of other devices, and it depends on your county and what they'll allow and things like that. So just wanted to show you what great work Glitzy was doing. And I'll take one last question and then we'll move on. So what is the cost of the GrandPad, Cassie?
Okay, so, and it was, I don't know if it was because it's our contract. Again, I didn't do the research. It actually all happened prior to me. I just was like, here's 100 GrandPads, make it happen, girl. So, so I didn't do the research, so I don't really know, but I did see that the monthly cost for a GrandPad under our contract was $73. So per each one, it was $876. And then, so for a year, if I was to purchase, so like my next goal would maybe to be purchasing or getting 10, so then I could like loan them out and get them back in, it would be like 8,760 a year, versus if I did like a standard tablet and purchased 10 and got internet on them, it'd be like 5,400 a year for the first year. The second year, because I'd already have the tablet, I just have to pay for the internet for the 10, would be 2,400. So it's a little more pricey, about 876 each.
And Jane Mahoney had put her mom's cost 700 a year. So it's really kind
Well,
of
we didn't get a deal.
I guess not. I think, it really depends probably on how many you're purchasing to
Probably.
and what kind of customization
The amount
you
of
want.
need that we had. And
Yeah.
yeah.
So,
for sure.
but definitely something to keep an eye on and maybe explore further. So just wanted to give you all some options and show you what's working pretty well. I think that's a huge increase in health promotion programs for the tribal community. So that's fantastic. If they're going to be online, it's great that they're doing a health promotion program. So
Yeah.
I think
Yeah,
that's
for sure.
great. Thank you for sharing all of that.
Yes. And if anybody wants to, they can just email me. I'll throw my email in there. In the
Great.
chat.
I appreciate that. And I'll
Yeah.
check if there's any other questions too to get the answer and send those out in the notes. So we'll go ahead and move along. The next item is going to be just updates from Gwar. So I'm going to just share my screen here. Great. And I don't see anyone else's video on. So if Cassie, could you give me a thumbs up if you can see my, thank you so much. Okay, so just wanted to briefly talk about some of our updates that we have here at GWAR, as most of you know, unless you are maybe new to the Aging Network, we have our 3-year aging plans due. I think the final is due in November. So almost everyone has submitted their draft goals, which is wonderful. I've reviewed several. I see a lot on social isolation and loneliness, a lot about health equity, racial diversity, which is wonderful. And what I saw in the chat earlier, just finding new volunteers for leaders and just taking a fresh look at what you're offering and trying to diversify that a little bit in terms of not doing all in-person classes, just in case with the Delta variant, we end up going online quickly. So I think the nice thing is we've had to do that, and we did it really well in a challenging circumstance. So now we have a little bit experience with that. So if anyone wants to brainstorm different ideas for your aging plan goals, please feel free to reach out. I'm happy to do that, or just give you feedback as you get your drafts back. A few reminders about SAMs and different best practices. It's really important to really keep up with the SAMs data entry. If you don't do the data entry yourself, just be aware that it's going in and you're kind of monitoring that because it's a lot if you try to wait till the end. So make sure best practices right after your workshop is complete, when you're turning in that paperwork, if it's a WEHA program, that you're doing, the data entry into SAMs right away. We want to make sure that you get credit for all the great work that you do. And it also affects future funding. So it's a really important step. And then as you're entering the data, make sure that you choose a subcategory. So in 23A, there's a subcategory for all of the evidence-based programs. And if you're doing a program and it's not in there, chances are it's not high-level evidence-based. But please reach out to me and I can offer you an explanation, or maybe it's a program that we need to add into our database. We don't have a complete listing of all the programs available out there. It's primarily the ones that are done in Wisconsin that are identified in a subcategory. And Carrie Kratz wanted to make sure I reminded everyone that the SAMS database will be shut down as of November 5th. So all your data entry needs to be done prior to November 5th. If you have any questions on that, reach out to Carrie Kratz and I'll make sure to include her contact information as well. And then I get a lot of different questions during the time of data entry and as people are filing their monthly claims as to what counts for high-level evidence-based programming, what can they spend their funds on. I do have a frequently asked questions document that I think is probably about 6 pages long now. So as I get different questions, I just continually add to that. And I will put the document or the link to the document in the notes, but it's always available out on the GWAR website under Technical Assistance Health Promotion. I tend to just refer people to the link because I do update it often. So it's great to, if you're fairly new to the Aging Network, to just go out and kind of read through it. Even if you've been here a while, just to read through and get an idea of some of the questions that are asked. And I am checking my chat too. So if you have any questions, please feel free to do that. I know Jane Mahoney is keeping an eye on it for me. And then the Aging Mastery Program, we have been a grantee from the National Council on Aging for the past several years. We are now finishing out our second 3-year grant, which will end in October. Over the last 18 months, we've distributed about 1,200 Aging Mastery starter kits through 80% of the state of Wisconsin, which is amazing. And then we have also had several different partners implementing the 10-session Aging Mastery program, as well as the 12-session Aging Mastery program for caregivers. So some of our partners include several different aging units, ADRCs, but then we have larger partners like the Extension, AHEC, which is Area Health Education Centers, Inclusa. So when the grant comes to an end at the end of October, all of our partners have agreed they have a lifetime license due to the grant. So the Extension is going to be continuing to offer the Aging Mastery Program, and they will be reaching out if they're in your area to the ADRC or aging unit. It's a wonderful thing to partner on, and it's a light lift if several organizations work together. And we've had over 300 participants in the program and 31 workshops in the last 18 months. So it's going really well. Some are virtual. We've had a few start in person, but we will be having our first Aging Mastery Program book club taking place in Jefferson and Rock County in September, and that's all going to be done in Spanish. So we're really excited to see how that turns out. If you have any Aging Mastery starter kits that you had ordered and you did not distribute, you can continue to distribute those. Or if you have some that you don't need, we would welcome those to be sent back to myself because we have several organizations looking for more materials. So just reach out to me and I can help with postage, etc. if you have any that you're not going to be using. And then the last thing I wanted to talk about before I turn it over to WEHA and Extension for a couple updates. Over the past several years, one of the gap areas that I've identified that aging units and ADRCs are asking for is mental health, evidence-based mental health programs. And typically, those programs are really resource heavy and takes a lot of training and finding the expertise in the area. Jane Mahoney, our caregiver consultant with GWAR, and I have been exploring the Healthy Ideas program, and a survey went out the last 2 weeks in the GWAR Digest just asking if aging units or ADRCs would be interested in more information on this program, and the resounding answer is yes. So Jane and I will be putting together a informational webinar to take place with the administrator of that program. But just to give you a really quick idea of what that is, it's a program that is meant to be one-on-one. So it's nice that you won't have to say, well, we'll be having a program in 6 weeks. It's something that, you know, can be done right away, one-on-one. It's available in English and Spanish, and it's designed to detect and reduce the severity of depression symptoms in older adults with chronic conditions and functional limitations. So it incorporates several different areas. One, there's 2 different screening tools, and the state can decide what screening tool that we're most interested in. And then it educates older adults and caregivers about depression and effective treatment and self-care. And then it works best to refer and link. So if you already have relations set up with primary care and mental health providers, that's wonderful, but it's a great opportunity to set up those relationships if you don't already have them. And then it's empowering older adults to manage their symptoms of depression through a behavioral activation approach. So basically they'll be screened, and then there's some goal setting, and then the provider, which is really nice because it can be your health promotion coordinator. It could be integrated into an existing case management that your organization may have. And it's over the course of, it can be as short as 6 weeks, or it could go 6 months. It really depends on the individual and the goals that they're setting for themselves. Technical assistance, I won't get into all this since we're running a little short on time, but the training is 2 half days. Typically it's done, they'll do a training with 20 interested participants. So, you know, with an aging unit or ADRC, it seems unlikely that you would have 20 people that want to do this. So this is something, if interested, that Jane and I would help coordinate with the purveyor, which is in Massachusetts, the Healthy Living Center of Excellence, the Elder Services of Merrimack Valley. So they are the purveyor of the program. It's currently offered in 26 states and for 100 partners. And they have all the Healthy Ideas written program materials. So basically you're printing those off. So there's not a huge cost in terms of participant materials. So I just wanted to give you some information about Healthy Ideas. So when you see and I will put in the email that I sent you all that has the notes. I will put the link to the survey too, just to see who's interested. But again, it seems like we have enough interest to move forward into doing kind of an educational webinar and then move forward with a pilot in some of our counties. So definitely exciting to be able to hopefully offer this as another item when you're social isolation and loneliness. If you're doing that as a goal, this is a wonderful part of that as well. So it is high level evidence-based, so you can use your 3D dollars and you can partner with people in your community to implement it as well. So I'm gonna pause quick. Jane, do you see any questions in the chat? I can't see my chat right now.
Nope, it's all looking good.
Great. So again, these are just the next steps. I'll include the survey link. We'll move forward with the webinar with the program administrator. And then if there's interest from that, we will explore how to possibly use some of our Arpa funds to help get this going in Wisconsin. Oops, we don't want to see that yet. We're not done with this. So I'm going to stop sharing my screen, and then I'm going to turn it over to Jill from WEHA to give some WEHA updates.
Thanks, Angie. Great meeting, everyone. I am Jill Rankin with Wisconsin Institute for Healthy Aging, and I'm going to actually turn it over to my colleague Erin and then Kris. They're going to go over a couple updates for you. One is the Stand Up Move More program, and then Kris is going to talk about our fall prevention awareness resources. And then at the end, I will just give a brief update on our 2022 leader training schedule.
Hi, everyone. My name is Erin Eggert. I'm one of the program leads for the Stand Up and Move More program. I presented on that one at this meeting, I think 2 meetings ago. So just a quick reminder, it is an evidence-based sedentary behavior reduction program. It is not a physical activity program. We just encourage older adults to stand up more often and for longer duration throughout the day. And it is evidence-based to reduce sedentary behavior by 68 minutes per day. We had one of our facilitators training just happened a couple of weeks ago, and we have another one coming up in September. That's the 14th and 15th. We just had 2 individuals who are no longer able to make it to that meeting. So we have 2 spots open for our September facilitator training on September 14th and 15th. So if anyone is interested, because we're in the program translation phase of this program, taking it from research to putting the program package together, we're offering a special fee of only $100 for this training. And then this fall only, you'd be eligible to get a stipend for up to $500 for leading a workshop this fall. So if you're interested, please email me. I can provide you any additional information about the program or the workshop. I'll also put the website to the Stand Up program in the chat box along with my email. And I'd love to hear from you. I'll turn it over to Kris.
Thanks, Erin. Hi, everybody. Kris Krasnowski with Wisconsin Institute for Healthy Aging. Just here to remind you that September is Falls Prevention Awareness Month. And as is traditional, we will be doing a variety of resources and putting up, in fact, on our website already, there's a page dedicated to Falls Prevention Awareness resources. We do plan on having a call on Thursday, and I sent it out as a calendar invitation to many of you already, but I will throw it in the chat as well so that you all can, if you are interested and would like to join us, it's open to anyone. We're really going to be talking a little bit about the newly formed statewide falls prevention initiatives. There are several work groups that are working on that right now. And the public awareness work group is a group that will be working on and talking about the resources that'll be available to you for Falls Prevention Awareness Month. We know many of you already have things going on in your communities. So the other part of the call will be to talk a little bit and discuss what efforts are going on locally. We are also going to try to capture all of that information and keep it on a link on the page so that those of you who may not be doing falls prevention awareness activities this September, but would like to promote things that are going on around the state, particularly those things that might be online that people can take advantage of, that you'll be able to find those resources there. So we'll be talking about that as well. We'll also be talking a little bit about how this new statewide effort might be able to support local falls prevention efforts. So as we're just getting this ramped up, and I think it's been, about 5 months that we've really kind of gotten some traction with this effort, we're going to really want to look to the other local falls and injury prevention coalitions to work together with us to create some resources and tools that can raise awareness of falls prevention, not just in September, but all throughout the year. So, because obviously people don't just fall in September, they fall all the time. And that's the one thing we really do want to work to prevent. So I put the meeting information in the chat. Please feel free to copy that out. The next webinar is again Thursday, starting at 11. So we hope we see many of you there, and we'll have lots of time for folks to ask questions and talk a little bit about what's going on locally. And that's it. Jill?
Thanks, Kris. And then did you mention, sorry if I missed it, is that going to be recorded?
It will be recorded, yes. And we'll share that recording.
Awesome. Great. Thanks. All right. All I really have is to let everyone know that we are working fast and furious over the next week and a half to get you a 2022 leader training schedule for all of the WEHA programs. So I can tell you that we are excited about 2022 and excited that a lot of our program providers are ready to replenish leaders that may have been lost during the COVID times or work at growing programs. So we are going to be providing both a mix of virtual trainings as well as in-person trainings. Depending on the program, most of our programs have both options throughout the year. So there will be at least, I think we've got about almost at least 2 trainings per program for the whole year, if not more. There might be some exceptions. So a very full year of trainings coming up. So that will be posted. Our goal is to get that out September 1st. It may be that week, but the first week in September for sure, we will have at least a tentative schedule with many of the programs having all the details, or the trainings having all the details set. There might be a couple other little logistics that need to be followed throughout the year. And obviously everything is subject to change with COVID. So you'll see, so even some of the in-person trainings will have a little note on there. Some of them have an online backup date. So hopefully we've got things pretty much figured out as far as how to do this during these challenging times. So stay tuned for that. You'll get an announcement, as well as you can always check our website. And that's all I have for WEHA, unless anybody has any questions. It looks like Lisa has a question here. Vivere. Okay, so we do have a Vivere leader training happening. Right now, we have 3 people signed up, so there's lots of slots still open in that one. So I think that's one thing. I know not a lot of you have a huge Hispanic population that you are serving, but if you do, and you're interested in the Vivere leader training, that's the Healthy Living with Diabetes program, the Spanish version of that. So if anybody has any interest, we've got a training coming up starting at the end of September, and that is in person in Janesville. So if anybody, or if you know of organizations that may want to, that are serving that population, that may want to hop on board with that population, I'm happy to talk with them about it. So you can pass along names and contact information, and we can go from there. So thanks, everyone. Another stepping on virtual leader training, since the last in-person was canceled in September. So if Shannon is on, I'm gonna let her answer that. Otherwise, I'm pretty sure that there's nothing more happening in 2021. I think that's safe to say, but we do have a lot going on in 2022.
Well, and I think Shannon is listening, but she wasn't able to talk. So.
Oh, okay. So maybe she can correct me if I'm wrong, if she might be planning something that I'm not aware of. But from what I know is that there's nothing more happening in 2021. No other trainings are being added.
Great, thank you for all the updates. Let's see, Erin did put Shannon's not on right now, but that is correct. No other trainings. So Perfect. Thank you so much. And if you haven't had a chance to go out and look at WeHow's website, if you're looking for materials to put in newsletters and that type of thing, the amount of content is fabulous. So there's tons of customizable ready materials for you to use for grab and goes and that type of thing. So go out if you haven't been out there lately to check it out. And then I'm going to turn it over. I know our largest program last year with our aging units and ADRCs was the Strong Bodies program. So I invited the extension to come on and just do any Strong Bodies updates. And they are our largest partner with the Aging Mastery program as well. So I will turn it over to Angie Flickinger.
Thank you, Angie. Yes, so I'm going to give you the 1-minute version, and if you are not already sleepy-eyed in this afternoon. So Extension is offering Strong Bodies. We just had a training and we're offering virtual Strong Bodies for any counties that don't have capacity to do it locally. And that will be an ongoing thing that's offered through the state virtually. And if you are interested in offering Strong Bodies in partnership with Extension locally, please reach out to your Extension educators in your county, because we have some amazing staff around the state that can do behavioral health training and education, nutrition education, caretaking, and lots of other programming that you may be able to connect with. We do have the WeCope program, which is also an evidence-based mental health program to increase coping skills. And we have many educators trained around the state on that program, if that's something that you're interested in leaning in. But unlike the one Angie described, it is a 6-week class with, a couple hours each week. And then we also have a new grant for the Strong Bodies program to get more bilingual Spanish-speaking educators trained. So if you have partners in the community or volunteers in the community or people in the community that are bilingual, that would be a good fit to get trained in the Strong Bodies program. We have funding right now to get them trained and get some equipment to your community to reach that audience. And let's see, I think that's it. But if you need to make any connections about programming and in your local extension offices, please let me know. Angie and I have been working with many extension ADRC aging units around the state, trying to see how they can work together to implement programming.
Great, and I did put Angie's email in the chat for everyone. Hope you don't mind, Angie.
Thank you.
Maybe I should have asked before I did that, but
it's public.
Okay, so as Angie had said, that oftentimes we'll have extension educator and an ADRC or aging unit wanting to do the same program. So we'll connect the two and do a virtual meeting and talk how they can, use their resources, funding and staff wise to accomplish that and get more health promotion offerings to to your older adults in your community. So don't hesitate to reach out to me and we can make that connection as well. So I don't have anything else on my agenda, which we finished with 2 minutes to spare. So that's fabulous. So the next webinar is scheduled for November 9th. And if you have any burning topics that you would like me to address, I do have some things on the agenda, but please feel free to reach out and I can always get it on a future agenda as well. And I'm just checking my chat box to see if there's any questions. Luann has a question. If we partner with the extension on Strong Bodies and our Aging Mastery, can we enter those participants into SAMS? Great question, Luann. And if you are spending any of your Title III dollars on supporting the Strong Bodies or Aging Masteries, whether it be you have a staff person or you've purchased the participant materials, and I should also mention, which I failed to earlier, the Aging Mastery program is high-level evidence-based in about 10 states right now, and Wisconsin is currently going through that process, and we should know before the end of the year if you can use 3D funds. However, if you're doing the Aging Mastery for caregivers, you can use your caregiver dollars for that as well. So reach out to me with any funding questions, and I can help talk through some of those. But the answer to your question is yes, Luann. If you use any of your 3D dollars to support it, then you would collect that data and enter it into SAMS. If it's a very, very light lift where maybe you just put it in your newsletter, but you're not really doing any of the implementation costs, then that would not count. But if you're using 3D dollars towards the implementation, yes. If you need more specifics or you have a specific question, please feel free to reach out to me on that one, but great question. So I will be putting all of the materials that Carly and Chantel talked about into the notes, and the link to the mental health survey that Jane and I are doing, that will also be in the notes, and hopefully I can get those out before the end of the week. So I look forward to seeing you all in November, but if you have any questions in the meantime, again, happy to respond. So just send me an email. Thank you so much and have a great afternoon.